So there. I have been wanting to send out this a recording to speak about insurance and the way that it affects credentialing and contracting, which are two different elements that actually meet each other at some point. I keep putting off this video because I think I need to have everything right, and I'm just gonna go for it. So the first thing I want to explain in regards to credentialing with insurance plans. The purpose of credentialing with insurance plans is for you to become in network with that specific insurance company. Becoming in network with an insurance company allows members who have that insurance to find you, to find your services, and to be automatically referred to you. For me, it's like a free referral service. And then also, those members can use their insurance to pay for your services so that they actually, it encourages people to actually go for therapy, right? And to get the mental health services that they need because the insurance will help them pay for it. So just want to put that out there first. Now, credentialing takes a process depending on the plan. I can't control it. I just make sure I can send the applications to them and I can follow up. And over the years, I have received different contact information, though they have changed over the pandemic, as you can imagine. But it does help to just speak to someone just so that you know the application is rolling along. But again, at the end of the day, I have no control of how long they take. But typically, it takes anywhere from 30 to 180 days. And after the pandemic, it's actually taking a little bit longer as a lot of plants have had big backlogs since a lot of people are working from home and don't have the same kind of bandwidth or resources they had in the office, um, from what I understand. So, insurance companies, when you network with them, you become participating providers. And insurance companies, we're in New York, right? So, we think of, I'm going to go over your basics Medicaid, Medicare. Those for me are like the foundation of what's to be added on, the add ons. Health First, Fidelis, MetroPlus, Aetna, Cigna, Empire Blue Cross Blue Shield, Affinity by Molina. Um, who am I missing? I'm not quite sure, but you get the picture. So, what happens with members? Let's talk about members. And let's remove ourselves from thinking about you as a provider. Let's think about you as a member. You need health insurance. You sign up for health insurance. Take care of your own health needs. You are the member. You now have that card. So in front of me, I have my Cigna insurance card, right? So I have Cigna insurance. I will use and call Cigna to find out what services I can get that they will help pay for. Either they pay for 100% or I might have a deductible, I might have a copayment. However, the coverage is set up from the beginning, this is underneath my job, my employer, right? I'm just putting that out there. So this plan will then pay for different things. For myself as a member, I qualify for Cigna, just Cigna insurance. But you might come across people who have Medicare. They have Medicare and they have Cigna. They have two different cards, two different plans. And these two plans cover sometimes overlapping costs. So in some cases, Cigna could be the primary insurance, and the Medicare, which is, let's just imagine I have a card in my hand, is the secondary insurance. Or it could be vice versa. Medicare could be the primary, and Cigna could be the secondary. What does that mean for you as a provider? That means you have to be both a Medicare provider and a Cigna provider. You have to fill out applications for both companies in order to take me as a member who has Medicare and Cigna in order to accept this insurance. You can't just be a Cigna provider with somebody who has Medicare, and you can't just be a Medicare provider for somebody who has Cigna. You have to be a provider of both networks in order to take the insurance. Now, how they break down and benefits and who covers what, you have to call the insurance company and find out. I usually call Cigna, ask them, are you primary or are you secondary? First question, because that tells me where am I sending the claim to first. And then I say, and what do you cover. If it's primary, I'm calling from a mental health provider's office, outpatient services. Sometimes I give the basic codes and they'll tell me if they cover that, yes, and things of that nature. We know Medicare does cover those things. So if Cigna is the primary, what happens is that they'll pay their customary charges, and there's usually what's called patient responsibility left over. That's part of deductible co-payment, right? It all goes towards the member's complete out-of-pocket costs. That's going to be a whole nother video. But what happens is that if Cigna pays, let's say they allow $200 for a visit, right? But the client has a copayment of $50. So they send you a check of $150 and say the client needs to pay $50. What happens is that $50 balance on that Cigna EOB goes to Medicare, and Medicare will pay the $50 copayment for the clients. It doesn't go to the clients. Okay, so first the claim has to go to Cigna. After Cigna pays, the claim then gets what we call waterfalls to Medicare so they can pay the balance. Then Medicare, if they reject it, if they say no, whatever, then that goes to the patient. But first you have to send the claim through the proper channels in order to get it paid. Same thing if it's vice versa. If Medicare is the primary, the claim is going to go to Medicare. Medicare is good at sending the claim automatically to the secondary insurance so that I, as the biller, don't have to, versus Cigna won't do that. But Medicare will pay whatever they allow, their portion, waterfall the balance to Cigna, who will then pay the rest. Okay? And that's usually how the payment is gone. That's usually how the networking goes. So I wanted to give that specific example because it works no matter what insurance you plug in. So if there is a client who has Medicare and Health First, same situation. You have to be both a Health First provider in network and a Medicare provider in order to take that client's insurance. You can't be one or the other. You have to be both. Okay. So I just want to explain that. Now let's remove Medicare from this whole conversation. Let's bring in Medicaid. Medicaid with the health insurance is called managed care. That's what they call it, managed care plans. So there might be a member who has a lower income who qualifies for Medicaid. Medicaid doesn't pay for insurances straight anymore. For some people it does. Depends on the class that you are. That's a whole different conversation. Most, 80% of the population will have a plan. I'm going to stick with Health First for my example. And we're imagining that I have these cards in my hand. This is Health First. This is the Medicaid card. So the client has the Medicaid card and the Health First card. You as a provider need to be both a Medicaid provider and a Health First provider in network in order to take that client. Okay? Usually clients who have managed care do not have a copayment. Usually the plan, Health First, pays 100% of the cost. Okay? In this scenario, Medicaid will probably never get a claim. For the client, for the member, Medicaid will pay probably for their prescriptions and other things, and not their doctor's visits, not their therapy sessions. Because with mental health, I'm going to stick with therapy sessions. Or the claims will go to Health First. Okay, there will never be that waterfall that I mentioned before. But for credentialing purposes of this conversation, you have to be a provider of both Medicaid and Health First. You can't be one or the other. Otherwise, you cannot see the client. The claims will not get paid. So I hope this helps to clear up exactly how Medicaid and Medicare work in conjunction with the health insurance plan. So a lot of times when I meet providers who are doing this from scratch to get their private practices off the ground, I say you need to start with becoming a Medicaid and Medicare provider first. Those are the basics. That's the foundation. Okay. That then, after you become those providers, you apply for the plan. We have, like I said, the Health First, the Cigna, the Aetna, every plan that I mentioned before. You apply for those plans because what they're going to ask on that application is, are you a Medicaid or Medicare provider? And once we say yes, we have to give your Medicaid and Medicare ID number to the plan so they can attach you to all the Medicaid and Medicare plans underneath their name. Go back to Health First. Health First is the name of the insurance company. Health First has Health First Medicaid, which is the managed care. Health First has Health First Medicare, which is Medicare Advantage. Health First also has non essential plans, which is just called commercial plans, which is not connected to Medicaid or Medicare. And those usually are very small and minimum population, but they will exist. So for each product line, that's what they call it, product line. So Health First has multiple product lines underneath their title. And for a provider to be attached to those different contracts, you have to meet all the requirements, which is why I always tell providers become a Medicaid and Medicare provider first. So when we're doing the main applications, the basics is done. And usually Medicaid and Medicare sometimes gives us a hard time because they're very picky, very specific with documentation, naming mechanisms, addresses, and things of that nature. They're usually the most tedious applications to complete. So once those are complete and we go after the health plans, they're much smoother and easier. Okay. So just felt the need to try to explain that and give a little visual. I mean, I have the cards in my hands, and if you need, I can try to Google an image of a card. I don't know if that would help to give you more of a visual, but I did want to explain how the credentialing process works. So really quickly, I want to plug in contracting. Contracting works when you have your group, right? So credentialing is for individuals, contracting are for groups. So what happens is whether you have your LLC and you have an organizational MPI, which is also called MPI 2, and you want to contract your group because you're having other licensed providers work for you. Now, different plans have their different requirements. They require a certain number of providers for you to have in order to consider you as a group. So that's one thing we have to think about first. How many licensed providers do you have to see if you'll be considered a group? Okay. Let's say you have, I'm going to go with a big number just to go through with the contracting explanation. I'm going to go with like 10 licensed providers for your group, right? Once each individual is credentialed, going back to that original conversation, right? Each person has to get credentials. So each person has to be a Medicaid, Medicare provider. And then I also have to fill out an application with Health First, um, Aetna, whoever the plan is. I have to do all of that for each person because their own individual account has to be set up. Then I also have to fill out with just the plan, Health First, a group application that will then start a contract. Once these individual providers, I said 10, but I don't have more hands. Once each provider is credentialed, they're then tied to your group. So all of these things have to be done, right? You can't just do a group application and these providers are not credentialed. If they're not credentialed, this is not going to work. They have to be once Health First or Aetna, whoever is looking at the group, and you're giving them the name of the providers and the MPIs, they're going to look them up in their system. And if they're considered out of network, they're going to say, we don't have them and they need to be credentialed before we can tie them to your group. You want them tied to your group because they see patients underneath your group. The payments need to come to your group. The claims will be done on the group. The individual providers will be considered rendering providers, which is why they need to be active in the system. So, yes, more paperwork, more credentialing needs to be done when you have a group of providers underneath your belt. Okay. Now, let's say you don't have enough providers to be considered a group for a contract. This goes away. But what happens is that each each individual provider, let's say you have 3 people, right? Not including yourself. You have um, three licensed providers. But for a plan, I'm just going to pull Aetna. it's not enough. You need to have more, right? So you don't qualify to be considered a group. So what's going to happen? We have to credential each provider individually. And when we're doing their application, when it comes to the payment section, we're going to put all of the payment information with your LLC group's information. So when it says pay to, put your LLC's name, your LLC's EIN, your LLC's MPI. That's what we're going to do. So when this individual provider sees a client, the claim needs to go out with the individual provider's information as the rendering provider, and on the payment line, because we put the group's name, EIN, and MPI will be the group's information because that's what we put on their application. So the data that goes on the application is vital. Okay. And that's how the workaround can be done when you're starting to build your group, but you don't quite have enough people to be contracted as a group. But keep in mind, once you have enough people to be contracted as a group, you want to then reach back out to the health insurance company and say, I want to do a contract for my group to connect my providers. And that'll be a whole nother process. It's not ever simple. It's not like, okay, we've been with you for 5 years. Okay, sure, we're just type in something in a system and just be done. It's always paperwork that has to be completed. You have to follow up on it because people, representatives and insurance companies don't just have your practice as their clients. They have a lot of clients underneath their belts and they tend to sometimes forget. So people are people, right? We're all human. And so reminders and follow ups are essential, which is why I use a system that gives me a tickler to remind me when to follow up. So I hope this video was helpful in explaining credentialing and contracting and how it works and the order in which it should work in order for you to be able to take a member's insurance. If you have any questions, please feel free to reach out to me. Okay, bye for now.